Let's talk about one of the most complicated and, frankly, most personal industries out there, health insurance. A quiet revolution is actually brewing. A whole new wave of startups, armed with tech and a completely different playbook, are starting to challenge the old guard. So let's dive in and see exactly how they're pulling it off.
You know that feeling, right? When you're staring at a medical bill or trying to figure out your benefits, and it just feels impossible. Well, you are definitely not alone. It's this universal frustration that has basically defined the healthcare experience for decades. But what if it didn't have to be like that? At its heart, what we're seeing is a major clash between two totally different philosophies. On one side, you've got the old way, a tangled, confusing mess that's slow, reactive, and you never really know what things cost. But on the other side, you have this new approach that these startups are pushing for. They're aiming for something simple, proactive, and totally personalized. Okay, so before we can really appreciate where we're headed, we have to understand what we're trying to fix in the first place. Let's take a quick look at the system these companies are trying to disrupt.
Think about it. Hidden costs, endless paperwork, and a system that honestly feels like it's working against you, not for you. All that complexity creates this huge wall between you and the care you actually need. And that right there, that's the exact problem these innovators are going after.
All right, now for the really exciting part. Enter the disruptors. This is a new class of companies that looked at this totally broken system and saw a massive opportunity for change, even though it's a huge uphill battle against some real giants. And look, this isn't just about offering a slightly cheaper plan or something. This is a fundamental reimagining of what health insurance can even be. They are putting the user, you, back in the center of the whole equation, and they're using tech to build a better, more intuitive experience right from the very beginning. What's so interesting is that each of these companies is attacking a different piece of the puzzle. You've got Oscar Health, who are laser-focused on making the user experience beautiful and simple, almost like your favorite app on your phone. Then there's Sidecar Health, and they're tackling the pricing problem head-on, letting you see costs up front. And finally, you have Clover Health, which is all about using AI to make healthcare smarter and more about prevention. So what's the secret sauce here? How are they actually making this happen? Well, it all comes down to technology, but it's being applied in some really clever and innovative ways. We're seeing whole new business models just pop into existence. Companies like Bind are creating what you might call on-demand insurance, where you can literally activate extra coverage for specific things only when you need it. Bright Health, on the other hand, focuses on building these really deep integrated partnerships with just a few hospital systems to make care totally seamless. And then there's this payer-provider model. We'll get to that in a sec. Let's use Clover Health to really see how AI is changing the game here. Because it's not science fiction. First, their platform pulls together all of a patient's health data. Then, their software, called the Clover Assistant, gives a doctor real-time, data-driven suggestions right there during a visit. And the result? The entire focus shifts from just treating you when you're sick to actually keeping you healthy from the get-go. And this brings us back to that third model we just mentioned, the pay-vidor. It's a bit of a mouthful, but companies like Devoted Health are pioneering it. The idea is actually pretty simple. They are both the insurance company and the healthcare provider. By aligning those two things, their main goal isn't just processing claims anymore. It's about delivering high-quality, efficient care to keep their members healthy. It just makes sense. Okay, so this is all really fascinating from a business and tech standpoint. But what does it all actually mean for your health, your experience, and yeah, your wallet? Let's bring it back to you. At the end of the day, the goal of all this disruption is a better outcome for you, the patient. We're talking about real, tangible benefits, like lower costs, or a simple app you can actually understand, or care that's way more personalized. This whole revolution is designed to directly improve your healthcare journey. And here's kind of what that looks like when you break it down. It's a mix of things all designed to make your life easier. We're seeing lower costs because things are more efficient. A much, much better user experience that cuts down on all those headaches. Plans that are actually personalized to fit your needs. And finally, a system where you can actually see prices. And all of this is built on top of that crucial shift towards preventive care. You know, this quote right here, it really just captures the soul of this whole movement. For decades, the entire financial model of health insurance has been based on reacting to illness. These startups are trying to flip that entire model on its head and build a system that actually profits from keeping you healthy. So, what's the final verdict on all this? Is it just a passing trend, or are we really witnessing a permanent transformation of the whole healthcare landscape? The big bet here, the gamble they're all taking, is that once people get a taste of a simpler, more transparent, and more effective system, they'll never want to go back. They're betting that a better experience isn't just some nice-to-have feature, it's an essential part of modern healthcare. And that really leaves us with the big, open question, doesn't it? Are these startups on the verge of actually curing the deep, systemic problems in our healthcare system? Or are they just creating brilliant solutions that only treat the most painful symptoms while leaving the underlying disease untouched? I guess only time will tell. Thanks for joining this explainer.